having moved from a country that doesn't have a system like the NHS, I see how amazing it is, and I want to do anything I possibly can to help it. For me, innovation is just trying to find a new way of doing something differently and in a better way. As humans, every single day we innovate in a little way. And I think we need to embrace that and to realize that it is something that we can just do. We are here to really support innovators who have proven innovations and at a certain stage where they may be one or two places, but kind of need to move that next level. We have clinicians look at it for the kind of clinical need, feasibility, and even the scalability, because they'll understand what will work within their patch. Then we also get patients who will look at it too, because they'll be able to say the clinical need also from their point of view. Lived experience patients who actually have engaged with that specific issue. We've got experts in commercial and implementation. There's so many checks and balances in there that any innovator who comes to us knows that it's going to be rigorous, but then also anybody within the NHS knows that we've already done all those checks for them. They don't have to sit and think, is this innovation? Has it got good evidence? We will show them the evidence. Is it usable? We will show them it's usable. You need to have their backgrounds also come from a different demographic. They need to be representing the public that they're trying to support.
There's a lot of change happening in the NHS. How do you think that's impacting the spread of innovation?
It is really impacting it. Decisions aren't getting made and the funding is just scarce. What it does do is put everything just at a standstill. And health can't be at a standstill. Our patients are still dying. Our patients are still getting sick. So there has to be a real balance. At this point, create your really great foundation in this little bit of a lull so that you can just keep building on it. It is absolutely hard to sell to NHS. So when I think of our kind of biggest success stories, they are not the ones that we have supported in the last 2 or 3 years. They're the ones we supported 10 years ago. This is not an overnight sensation. It is a $1 billion industry and we're not touching it in the UK. I genuinely can't understand, even from like a business point of view, why people aren't jumping on this bandwagon.
Hi everyone. Welcome back to Inside Health Innovation podcast, where we usually interview innovators and founders in the health tech and digital health space. However, today's episode is a little different. I'm your host, Karina, and today I sit down with Mindy Simon, the co-director of NHS Innovation Accelerator, better known as the NIA to those in the industry. Now, NIA is by far one of the most influential innovation spreading program in the UK healthcare industry. And if you're an innovation, a clinician, a policymaker, Mindy's insights into the current landscape of the NHS, what kind of innovations are missing from that landscape, and how to actually spread your innovation into this space are absolutely not to be missed. She talks us through her entire journey from running primary care in Trinidad all the way to now co-directing the NIA program. So without further ado, let's jump right in. Hi, Mindy. Thanks so much for joining us on Inside Health Innovation podcast.
Hello. Thanks for having me. Super excited to be here.
Thank you. And there's so much we need to talk about, but we know we've got a short period of time. So I'm going to get straight into it. And my first question is really just about understanding your background and how you came to lead this NHS Innovation Accelerator program, which we understand is a national program. It's kind of renowned as the best place to go if you want to spread your innovation in the UK. So tell us a bit more about your background, please.
Lovely to hear people think the NIA is so amazing. Fantastic. So my journey started probably far too many years ago. I actually grew up in Trinidad. So when I was there, I ran a small primary care practice, and I really enjoyed seeing that kind of patient care journey. So when I moved to England, I tried my hand at other sectors, so like recruitment and events, but then I kind of gravitated right back to health in an alternative therapy place using chiropractic. So that just kind of restarted my love of helping others and in their well-being. I did kind of various stints in supporting executive functions at like Oxford University and King's College London. And then I ended up in UCL Partners, which is like my home at the moment because I love the place. And they deliver the NIA and other health programs, of course. And about 8 years ago, I joined the NIA after coming back from maternity. And I thought, I would like to try my hand at something a bit different. And innovation felt like a really great space. I absolutely love this space and I love supporting the NHS. Having moved from a country that doesn't have a system like the NHS, I see how amazing it is and I want to do anything I possibly can to help it.
Yeah, that's such a great point. I think sometimes people get funny about how the NHS is functioning, but I think the most important thing to recognize is this system is quite unique in many ways, and one of the best ones in the developed world, as you rightly say. A lot of other countries don't have this type of system, and that is something to be appreciated almost every day, isn't it?
Absolutely.
That's such a great background. And now I can hear the accent just as you said it. So you've talked about how obviously exciting you find innovation, and especially in the healthcare space. So tell us, what does the word innovation in healthcare, and in particularly in this unique environment of the NHS in UK, what does that word mean to you?
Innovation is, I think, a really funny word interpreted in many different ways. And I think before I came in to the NIA, if you had said to me innovation, I would have been slightly intimidated by it. I would have been like, it has to be shiny, it has to be beautiful, it's got to be brand new, and it has to blow your mind. But for me, innovation is just trying to find a new way of doing something differently and in a better way. I'm a parent of 2 young children, and I
So
think as a parent, you're always innovating. You're always trying to find a new way to do something just because of necessity to get it done. And I think we as humans, every single day, will innovate in a little way. And I think we need to embrace that and to realize that it is something that we can just do. And I think that's the same for the NHS. The demographic and the population evolving. So we need to evolve in the way in which we do things just in a general, in every single way. We need to think of new ways of doing it. And we need to get that mindset. We need to take the mindset from our normal lives of innovating in a really small, minute way and think about innovating in a really small, minute way in the NHS also. So we need to kind of be really conscientious about it. We need to bring everybody on board and recognize that everybody has a different understanding and willingness to engage with innovation. But we need to recognize that everybody can engage with innovation and embrace that. Find the little nuggets and really hold on to them and help those people grow and just encourage them. So if you see somebody doing something a little bit differently and you're thinking, oh, well, that may not be a great test, don't say that. Say, this looks really great and let's see how we can help you. And I think that's one of the things is because we're all doing it, we just need to embrace that we're all doing it and find a way to help us harness that innovation in us.
Yeah, no, that's such a great point. As you say, sometimes it's not the big sort of dramatic, transformative innovations that make a difference, but sometimes it's those gradual little innovations that come together and deliver the biggest impact as well. And, having a background working on the front line in the NHS, that's exactly how I think most change comes. It's all sort of little gradual changes with a lot of people involved, as you say, because so many people are involved in any process within the NHS. So it's never a one person or team job. It's always collaborative. So speaking of how to find innovation and spreading innovation in the NHS and sort of embracing it, as you rightly say, for those who are unfamiliar with the NIA program, please tell us a little bit more about it and I guess what led to the creation of it as well.
Okay, so we are called the NHS Innovation Accelerator, but most people call us the NIA. And we were created 10 years ago because at that point, there wasn't really any support for innovators who had great innovations to get into the NHS. So there was support at the start, like the complete start of your journey where it's like that research space, there's always funding, there's always people wanting to do stuff. But when it got to the point where an innovator had already piloted, was doing something somewhere, that kind of next step wasn't there and they didn't really understand it. So you can have a really great innovation that's kind of groundbreaking, but you didn't know whose door to knock on, how to get in front of that decision maker. And they were failing because they just couldn't get any traction. So you needed a mechanism for them to understand what to do and how to get that visibility. And that's how the NIA was created. And we have the Health Innovation Networks, formerly the Academic Health Science Networks at that time. They had 15 of them and they had their own ways of supporting innovators, but they kind of wanted a national vehicle so that it wasn't just within their patch they were looking at. There was something that could spread it throughout England at that time. And that's how we came about. We are here to really support innovators who have proven innovations and at a certain stage where they may be in 1 or 2 places, but kind of need to move that next level, which is always, I think, one of the kind of harder starting points, because you can have found one clinician who thinks your innovation is amazing, and they will have helped you get into one area or one organization. But because that clinician will only work in that organization, it's very difficult to move to other organizations. So we are here to help the NHS understand that their innovation's there and available, and then to help those innovators understand how they access the NHS. I don't know any other place that does that allows that kind of visibility or that connection piece, because I don't think the NHS has the headspace to be able to say, great innovations, I want to see it. And also, there's a lot of innovations out there. There is a lot of innovations out there.
Yes, I mean, there's an absolute boom in that space.
Yeah.
And I guess so there's obviously, as you rightly said, there's 15 HINs or health innovation networks that have run their own sort of mini accelerator or supporting programs. I've been on a couple as well. How does that tie into the national program, or does it tie in at all?
Yes, absolutely. It does tie in. So the HINs we work really closely with them, and they're fantastic at what they do on their kind of local level. They really understand their regions. They really understand what's going on in locality. So they're able to kind of harness that knowledge and help us. So they do the care in the kind of first instance of helping the innovators get their kind of first foothold. And then they hopefully will pass them on to us at some point where we can help them move from their first foothold across, not nationally. I think when people say nationally, they think they're going to be in every single organization within the NHS. And I think that's pretty much impossible, given there's like 236 or so trusts. I mean, what innovation can do that? And in any case, you don't want that monopoly. So there is that issue where you should have competition. But the HINs themselves will then support our innovators also. So we will do that kind of comprehensive understanding of how you get into the system, and just generally about, you've been procured in one place and that may have worked there, but let's think of other models that you can be using. What is your value proposition? What's your market access? What's your procurement scheme? Also, like, what is it you're looking at within any kind of health inequality space and PPIE, how you're working at all of that. So we do the kind of more intensive wraparound care around those specific innovations, and we have many layers of care that we of support that we provide. I think, and I'm quite biased, that the NIA probably provides the most comprehensive support package. But we work hand in hand with the HINs, because you can't have a siloed system. You can't have us doing something on one hand and the HINs doing something on the other hand. That just does not work. But we all work together as one, hopefully, cohesive ecosystem.
Brilliant. No, that's really good to hear. And you've mentioned a little bit of the kind of support one gets if one was to get on to the NIA program as well. But could you tell us a little bit more about how you help these innovators scale their innovation, as you say, not necessarily in every trust, but certainly scale it bigger than where they join you from?
Yeah, great. So we have, as I said, we have various layers. I think we've got 8 layers, and we kind of put them in buckets of access, learn, and connect. And the kind of access pieces coming, first of all, as a kind of program team. We've got quite a lot of knowledge within this space. We also have quite a lot of tentacles. I kind of understand, well, here's your critical friend. We're here to cheer you on, to make sure that people speak about you because we speak about you. And then the other kind of access piece was mentoring. So we give you access to mentors who you can tap into as and when you need them. And it can be a simple thing of asking just one question and having that question answered. Or we've had mentors go into businesses and actually, while the CEO has been on maternity, step in and take their place. So it's very much it depends on what you need from that mentor and what they're willing to give. But we do that kind of mentoring piece, which is really quite important, because you need to hear a range of voices throughout the system, and not just the health system. It could be somebody. I think we want to connect somebody with somebody at Universal Studios, which is so random. It was hilarious when we got asked to do that. But we also we do, as I said, that tailored support around specific areas. So like around net zero, around health inequalities, around PPIE, and that's specific to that innovation only, where it's a real deep dive into it, and then we come up with a development plan and making them think about, what do you do better in that space? Because that's something that they need to engage with. And it may not be something that innovators think about right away, because it's not your BAU. It's not what you have to do in order to get a contract at that specific time. But you will be asked for it at some point. You will definitely be asked for it. Yeah. And then there's the kind of learning program we do, which is separated into, it's the kind of different streams, really. There's a year 1 stream and year 1, 2, and 3 stream, but anybody can join any of those. So it's not a case of if we're doing something year 1, you can't jump in from year 2 and year 3. And year 1, we tend to find it's about giving them the tools to understand how to work with the health system. So they'll come in with sometimes flawed understanding of what the health system looks like and, how to speak to it. So we give them that kind of basic knowledge, create that foundation so they can build upon it. And then in year 2 and year 3, it tends to be more about what is happening in the health system at that point that will affect you. So things like the political landscape, we did quite a lot of about last year when the new government was coming in, and think about, this is what they're going to focus on. What do you need to do to prepare yourself for that? So that's that whole learning program, and that goes throughout the year. It's quite comprehensive, and we get quite a lot of key stakeholders in the room, so decision makers, patients, legal, it kind of varies. And then one of the probably most important parts is the peer community, and that's where you have all the other innovators in the room with you, because that knowledge pool is insane. And it's also the people that you will become friends with, or you might work with in the end. You might end up collaborating with. If you're on one end of the pathway and they're on the other, you could come together and make a whole pathway system. So it is a lot in there in that small group of people, and we've supported over 100 innovators. So think of having 100 people you can have a chat with. Amazing. And then the HIMS, of course, we just spoke about. And then there's the innovation ecosystem, which is where we make sure that the fellows are able, as we call them, are able to feed into the kind of political arena and what's happening nationally and policy making. So it's make sure that they have a voice, because what they do and how they're affected by everything else within the ecosystem matters, and they need to be able to say that to somebody. So we try and help them say that. And we also make them visible in front of people. So we put them in front of key stakeholders, not necessarily as their sales arm, but to make sure that that the health system understands that the innovations out there that can support them. Because everything is so fragmented, it is very difficult, I think, for people in the system to know about all innovations that are out there that can help them, or even that there's something out there. We can all become really blinkered when we're doing our jobs. So we may not be able to think outside that very small box and think, is there something else I can use? So when we make sure to get those fellows in front of people in the NHS, again, not necessarily to sell this particular innovation, great if they do, but also just for the NHS to understand there's something out there that can help them. So it's kind of really, sorry, that was really long, but it's quite a lot of support that they get. And then
exactly.
So
it sounds amazing, and not all of that you can just get from a website. So thank you for giving us all that detail. And so just to be clear, it's a 3-year program, and do you recruit every year?
We do. We recruit every September, and normally we base it on a theme. And it's normally whatever the health service is calling out to us. So we speak all the time to everybody within the health service, varying things like Royal Societies, NHS England, trusts, primary care, etc., patient groups. And we try and collate what is they're looking at specifically. And then we put it as part of our theme, saying we're looking for innovations that do this in this space and that can address this problem. We're not saying how do you address the problem. We're saying that you need to address a problem and then tell us how you do it. What we did last year, though, is because of the political landscape at that time, it was so difficult for us to think what is the focus area is going to be. And we just did an open call. We just said, any innovation that can help the health service, come to us. We'll have a look at you. We'll decide if you want to come on. And we ended up with our bumper year of 28 fellows coming on.
Wow.
Our cutoff was 24, but I mean, there were such amazing innovations. We didn't want to say no to anyone.
That's brilliant. I do know a couple of the ones that have gone on it. So we've interviewed one of them as well. So in terms of just how you sort of select, so you've talked about obviously a themed selection sometimes, but last year it wasn't. How do you balance? You talked about obviously you don't want to make it a monopoly either. So if, for example, you have similar-ish propositions come to your door, how do you balance that need for perhaps competition, but also the need, the feasibility, all of those items? How do you manage that in your selection process?
So as part of our recruitment process, it's pretty rigorous. It takes almost 6 months to do. So it's not a just you write an application form and we go, yeah, you're great. During that application form, we have clinicians look at it for the kind of clinical need, feasibility, and even the scalability, because they'll understand what will work within their patch. And you get clinicians who are not just, let's say if it's cancer, the innovation addresses, it's not just cancer as a whole. It will look at their specific type of cancer they're looking at. So it's within real niche area we get clinical feedback from. Then we also get patients who will look at it too, because they will they'll be able to say the clinical need also from their point of view. Lived experience patients who actually have engaged with that specific issue that we're being asked about. And they'll also tell you feasibility, because from a patient point of view, a clinician might say, yeah, that's amazing, we can do this. And a patient might go, makes no sense to me. I can't turn up and do that several times over, so we get that as well. And then for the kind of scalability, we have somebody we've got experts in commercial and implementation. So it's not just about, will this make money? Yay, but it can't be implemented. So it's that kind of thing. We have quite an extensive recruitment process in that.
Amazing.
And they are not just assessed on paper, they're also interviewed. So we wean them down from the paper applications. And in between that, NICE looks at them and says whether or not they kind of fit in with the kind of political landscape. So is this something that's going to be keeping in the trajectory of policy? So if it's a digital innovation, but we know that they know in that space, that's not what the national system is calling out for something digital, they will let us know. So it's for us, it's also that understanding of what the national trajectory is, and NICE help us do that. And then they're interviewed, and then they go through due diligence to make sure they've done their regulatory. So there's so many checks and balances in there that any innovator who comes to us knows that it's going to be rigorous. But then also anybody within the NHS knows that we've already done all those checks for them. They don't have to sit and think, is this innovation? Has it got good evidence? We will show them the evidence. Is it usable? We will show them it's usable. We will show them pretty much everything that they need to know. And we're also kind of moving into the evaluation space, working with the Health Foundation of trying to figure out, trying to teach people within the health system is if you're thinking of implementing or taking on an innovation, what are the checkpoints you need to have to make sure that if you're going to do an evaluation of it, you need to have this in place. So we're spreading ourselves across to make sure we're supporting the health system in any way we possibly can.
Yeah, I mean, I think that's such an important point, because there's a lot of support maybe for innovators in this way, but just as important it is for those NHS organizations to test it in that space and evaluate it in their system. So that's such a great thing you're taking forward. That's so cool. And how important is perhaps diversity of thought and background in the innovators that join your program?
I think it's really important to have, it's necessary to have diversity of thought in everything and just in life. But when you've got those innovators coming together, particularly that peer network, when you're all sitting discussing, if you're all coming from the same perspective, you're just going to be an echo chamber and you're going to be saying the same things to each other, and nobody's going to kind of challenge you or give you a different perspective. And I don't know how you can address the needs of your stakeholders if you don't hear a different perspective. When I speak to early innovators, one of my kind of first questions is, what users have been involved in your creation of your innovation? And great if you have a user involved, but where does that user come from? And it's the same thing for innovators, is you need to have their backgrounds also come from a different demographic. They need to be representing the public that they're trying to support, because how do they know what their needs are if they aren't part of that public? So you can't just have people who come from one specific area, let's say just clinicians who have all been educated, public school educated. That wouldn't show what the man on the ground like me is doing. One of my first kind of CEOs I worked for was David Fish, and he is this amazing human being. He is a clinician by background, and he was the one who started UCL Partners. Right. And he always had this saying of, what are you doing for the man in Tottenham Court Road? Because that's where we were based. And every time he brought us back to that, he'd always be, how is this helping the man in Tottenham Court Road? Do you need to go and speak to him and tell him and ask him, really, is this good enough? And that's what I think you have to have with innovators. I think you have to have them talk to that man in Tottenham Court Road, or be the man in Tottenham Court Road, so they really understand the public that they're trying to help.
Yeah, no, that's a good illustration of what's required. No, that's such powerful thought process to go through. So thanks for that. And then just coming back to, I guess, the health system, and you talked about, obviously there's been quite a lot of change in the NHS. There's been a new government about a year ago, but then with the abolishment of NHS England, there's a lot of change happening in the NHS, and obviously we work with them quite a bit. How do you think that's impacting, if at all, from your perspective, the spread of innovation in the NHS?
It is really impacting it.
Yeah,
because I think I just want to say, I do think some good things will come out of it. I think the execution hasn't been excellent, but I think there could be some positives, and I think I want us to hold on to that first of all.
Yeah, exactly.
So I think right now, though, we're at such a really funny place that decisions aren't getting made because it's very difficult to understand who in 6 months' time that decision is going to affect. I can make a decision today, but my the next person who comes along will have to stick to that decision or will have to change that decision. So making any big changes and taking on an innovation is making a big change. It genuinely is. Because you have to bring that in, you've got to have that funding allocated, you've got to figure out how you implement it, you've got to start changing things within your organization. People just don't want to do that at the moment. I think we're really just stuck in this flux where just nothing has happened. And the funding is just scarce because, again, it hasn't necessarily been allocated. And once it's been allocated, you don't know I wouldn't say 6 months' time because I keep saying that, but the spending review is going to come out, the 10-year plan is going to come out in the next 2 months.
Yes.
We will know. So in 2 months' time, we don't know what that trajectory is. We don't know what the government is going to expect us to do. So to actually start making those decisions right now doesn't make sense. I completely get doesn't make sense.
Yeah.
What it does do is put everything just at a standstill. And health can't be at a standstill. Our patients are still dying. Our patients are still getting sick. So there has to be a real balance. But right now, we're not finding that balance. I completely get why. But I also I feel really sad that we're in this space right now.
And everybody we speak to through the podcast, but generally, in our sort of networks as well, which includes innovators and NHS, I think they probably share that view. We all understand what's happening, why it's happening, and many support some of the changes as well. It's just the taking away from the core of what the NHS is here for, even in a short period of time, is obviously not anybody's ideal situation. So no, completely understand. And I guess, what would your advice be to innovators out there to handle this kind of landscape and situation that they find themselves in? And how can they remain sort of resilient in this shifting dynamic?
I think you just need to keep going. I know that's really tough. I think you just need to keep going out there and talking to people and making sure you're still visible. So the customers that you have, harness them. Just literally make sure that you are in contact with them and you're giving them such an amazing service. But also still put yourself out there, make yourself visible, because when the change does happen, you want to be the first thing that they're thinking of. You can't wait for the NHS to make its decisions before you do anything. So I think innovators need to not be like the NHS. I think they need to keep moving and keep trying. So the NA is amazing, but we are not the only support program out there. And we shouldn't be, because again, that's a monopoly. Try and speak to your HINs of innovation networks. Go and speak to your trust, speak to your GPs, speak to the users. So speak to patients who will be your biggest advocates. At this point, create your really great foundation in this little bit of a lull. Create your foundation so that you can just keep building on it. When in 2 months' time, we have a better understanding of what's going to be needed. But don't wait. Don't wait in the sense of don't sit and go, I can't do anything now. You can do stuff now. You can start creating that. What is my scalable process? Let's hone my MVP at the moment. Let's do all of those type of really boring bits of business as usual and just keep getting that done right now. Just don't wait. Don't wait.
Yeah, no, that's very good advice. The day you stop progressing, that day you're declining, isn't it? In entrepreneurship. And then I guess, I'm a business owner who sort of works with the NHS, and obviously all innovators technically run businesses as well. But there seems to be a lot of conversations that I have and obviously experience as well, that even if this landscape wasn't in place, it's still hard to break into the NHS, right? It's a complex organization, and rightly so. It's massive and all of those things. But generally, it's unless you are perhaps in like you say, you've got those champions. Maybe everybody finds that it's hard to get into the NHS. The sales cycles are really long. And health tech, building health tech specifically, it's not cheap. So whenever I speak to innovators, they're always like, so I've not gone out and sought funding, but those who are seeking funding, especially with VCs, seem to hear back that, they're not interested if you're trying to sell to the NHS, it's hard to get that kind of funding. I guess, How much do you sort of agree with this kind of perception of how hard it is to sell to the NHS and how long it takes, and therefore funding is hard to get hold of? And I guess, what can be done to improve that?
It is absolutely hard to sell to NHS. I'm not.
Yeah.
Nobody should be lied to about that. The
Mm.
thing is, though, you have to make it slightly hard because this is public money. I think they make it a
Yes.
little too hard. I'm sure there's a way they can streamline it, and that's what we try and help them streamline it. I think, though, and you're right about the VC funding. There's,
Mm.
I always say to innovators, think to yourself, do you need VC funding? What is that the right route for you? Given that the kind of return on investment expectations are unlikely to kind of match up with your reality. There are VCs out there, though, that are more value-based. So they are not all altruistic, but they take a much more long-term view, and their expectations are slightly different. There are a few of them. It's more difficult to find them, but keep looking. And I think funding just generally in the last few years for anything health has actually been falling. So this is prior to all the issues that we're facing right now. So it's even worse, I think, given the uncertainty. Hopefully in the next 2 months, when there's a bit more uncertainty, then it might get a bit better. But really think to yourself, is your vehicle for staying alive VC funding? Is that really what you want, or do you want to try and be revenue generating? And I think innovators need to really consider that question before they keep going. Of course, it's going to be absolutely right for some people. Absolutely. If that's the space you need to be in, look for the right VC. There are the right VCs out there. One that is only looking to make a profit isn't the right one for the NHS. Or sorry, make a short-term profit. Yes. So they expect you within a year to be returning. That's not going to happen. And you need to be realistic about that too. I think innovators just really need to think to themselves, I need to recognize this is a 2, 3, 4 year process, depending on what my innovation is. And we have seen that throughout. So when I think of our kind of biggest success stories, they are not the ones that we have supported in the last 2 or 3 years. They're the ones we supported 10 years ago, or ones who started off with 8 years ago. And they're doing amazingly now, but they have done the hard slog. They have worked hard to get where they are. This is not an overnight sensation. This is not a YouTube video of somebody, a new celebrity. And if that, I feel that sometimes that's the mindset people have in this day and age, that you're going to be an instant thing. And like somebody's going to see you and be like, wow, you're so amazing. That's not the reality of probably everything else in life except YouTube or social media.
That's some real sort of truth talking there. And I think that's so true. And it's really interesting what you said about how the biggest successes are sort of the ones you helped 10 years ago rather than those in the last couple of years, because it almost sounds like, you have to be in this for the long run. You can't expect sort of, some kind of social media style success immediately.
And I'm not, would you want an innovation that had a social media success? I'm not sure I'd want an innovation like that.
No,
genuinely,
exactly.
You want it to be.
You want it to be thorough, right?
Yeah,
Especially when you're using public resources to fund it. I couldn't agree more. And I guess, so speaking of your biggest successes, I guess, what have been some of the big success stories that have come out of the NIA?
Everybody knows about Dr. Doctor. I think
yes.
I think if you don't know Tom, then you don't work within healthcare. They are a huge success story. And Tom is really always supportive of us. So we absolutely love Dr. Doctor. Orca and Liz, amazing. Orca, they've revolutionized that kind of regulatory space. Fantastic. One really boring one that most people haven't heard of is Nerve Center. They are one.
I know Nerve Center.
Because you work within healthcare, but most people elsewhere. Dr. Doctor is kind of patient-facing, so you would have heard of it. If you work in regulatory, you would have heard of Orca. Nerve Center is kind of backdoor. You may not know it as well. But they're fantastic. And there's some really kind of interesting ones. But, they're kind of real, I would say slightly boring, but I still love them, like MediShout, which is, for me, exactly what innovation should do. A doctor saw a problem that was affecting things like having operations, etc., because people weren't reporting a light was broken. So mundane, so boring, but the effect that would have on the kind of day-to-day running of a hospital. And he went and he came up with an innovation to help hospitals report that. And that is transformative. It's a boring one, but it's still really I hope Ash doesn't hear me say boring. I love you, Ash.
We'll bleep out the word boring.
It is one of those ones, though. It's not the sexy ones that everybody's like, that's so interesting. The power of something so mundane to make a difference, because I don't want to turn up in the hospital ready in my gown and I walk into that room and that light's not working.
Yeah.
I have to go back. I mean, that makes huge difference.
It's
So
so
there's
true.
some really interesting ones, you know, and then
Yeah.
I think we have the potential to do so much more now. We've got one representing D, and you may have heard it as a woman, but it's kind of HPV screening, and it's by using a tampon. How?
Amazing.
Like, why? Why is that not
So
being
much
happening
nicer
already?
for anybody who needs to have it.
Yeah, I mean, but it's just for women's health, and that's probably why
That's
it hasn't happened
amazing.
today, because we're only 50% in population in people's
Yeah.
mind, but only like 10% that they care about us. But it's like
Mm,
things like that, like things that
yes.
should have happened previously and that would make such a profound effect on women.
Yeah. Yeah.
Love it, absolutely love it.
Yeah. Amazing. So I guess, yeah. So let's hear more about, I guess, what is coming in the future. So have you got any inkling of what your theme might be? Or you might say, well, actually, we'll have to wait to see what the 10-year plan says for this year. But equally, what other things are happening in the space of innovation that you are aware of, or themes that you're keen on embracing in the NIA?
So AI, I mean, who isn't jumping on the AI bandwagon?
Yes.
I mean,
Yes.
everyone. I'm not keen on doing one that's around the kind of diagnostic bits or decision making. I'm slightly quite nervous about that myself, and that's because I don't think the regulatory framework is there. I don't know who's going to be accountable if something doesn't go right. I do think that's something we need to support regulators to look at.
Yes.
If the kind of ecosystem or infrastructure is correct within the government, etc., 100% want to be behind it. But AI to kind of look at the kind of back office functions and really kind of stratify innovation, and I'm really, really want to see that. Anything to do with supporting the workforce. I think right now we have a workforce that's extremely tired, but I think we have a workforce that's there and that we're not using effectively. I think anything that can kind of free up their time and I think harness the knowledge that's not being used would be great. Anything in women's health, I'll just say it because
Bring it on.
I just don't think we're doing enough in that space. But it is $1 billion industry and we're not touching it in the UK. I genuinely can't understand, even from like a business point of view, why people aren't jumping on this bandwagon. So anything women's health. And just because I'm a mum, I know there's probably not money in it, but anything to do with children. But if you want to jump on a bandwagon, find something in AI.
Yeah. Yeah, no, absolutely.
Yeah.
Well, funny you should say that, Mindy. We've got an idea, but
come to me and
anyway.
we'll talk about it. You can just I keep everything in confidence. But it's also like there's quantum also. And I went to a hackathon around quantum and I was like, why is nobody talking about quantum as much as they talk about AI? And I was like, but this has the potential to make an impact too. So maybe we need to start talking about quantum as much as we talk about AI, but I suspect it's because the money is behind AI. Anything that has money behind it will go further.
It's kind of the trend. And I guess quantum you know, and obviously I'm not tech myself, but it feels a lot more complicated even than AI. Not that AI is not complicated, but you know, you need a whole other level of skill set and academic background in quantum computing. And it
but that's
feels
the whole industry, Karina. That's the whole industry we should be creating.
No, absolutely. And I mean, you're right. Like, you know, the processing power that can bring. Gosh, what it could do for running big hospitals.
So somebody needs to be looking at that. Somebody needs to be looking at that.
Well, that's cool, because my next question was going to be, what are the underrepresented areas that you would like to see more on? So you've talked about women's health, quantum, obviously AI. Is there any other underrepresented space that you think, certainly from a healthcare perspective, any areas that people are not coming out with enough solutions on?
I think there's a curation in certain areas. The digitization of stuff, that's getting a bit saturated in the moment. Not a bad thing. I do wish innovators would stop and think to themselves, there's already something in this space. Maybe I need to rethink what I'm doing. I wish that happens. But as I said, I think that women's health space is one that's just, and I think particularly around the menopause area.
Yeah.
So that kind of,
so
there's two areas that are really not being looked at. So the kind of menopause and the kind of, I think maternity is one that's always looked at. And we support some great maternity innovations. Fantastic. And I'm really contrary when I say that. I think that's because people think that's all women are good for. Like our maternity is if, you know, they want to make sure we have babies, but they don't care about us. once we get too old. So, and I want somebody to look at us when we're too old.
Yeah. Yeah.
But there's also, and this is not about coming up with an innovation. I think this is about creating an innovative space. And one area that I do not, and anybody who's heard me speak will know I bleat on about this every time, is the education of innovation. So it's are we teaching people about innovation early enough?
Yeah.
Because when you get to my age, you expect me to make a change. You expect me to start thinking of how to do something differently. I'm probably too old. I don't, that's not my mindset already. But you hit those children young, they will start thinking innovations, they think we do. And that's the space I think you need to be doing it. That age between like 5 and 20, you need to be teaching them about innovation, and not necessarily just about a specific innovation, about that kind of general innovation piece of doing something differently every day. How would you do that? Particularly clinicians, they have been taught to do things a certain way. And we are now expecting them to jump on a different bandwagon. Yeah. I can get why they don't want to do that. I completely get that. It's not what you've been taught. Yeah. We should be teaching them that they can do things differently and giving them that permission from the time they're in training. Yeah. So that gap is not in an innovation. That gap is in the innovation landscape.
Yeah, no, I think that's just, you've hit the nail really on the head. I think there's something about what you're talking about is how do you create that crop of good innovators from literally when they're young, as opposed to just following the rules all the time. Not that following the rules is a bad thing, but to be able to challenge when required appropriately and think differently. And it's really interesting because somebody I spoke to, cardiologist, he talks about how, I've trained for whatever number of years to come and be a people's doctor, but right now I come in and deal with digital tools more than I deal with people. Yeah. And it's really interesting because we want to help them with some digital tools and innovation to make things more efficient, but we don't want to take away that people side as well. So how do you find that balance of you can do the change and the innovation, but you still get to hold on to, whatever's the core thing. But you're right, like clinicians especially, sometimes you feel like are resistant to change more so, but you're right, because, a long-term education teaches them to do only that one thing, and anything that sort of differs is quite like, well, why? This is not what I was trained for. I think that's such an important point to make. Okay, so sort of our final section as we sort of approach the end really is just you've talked a little bit about it, you've touched on a few themes already, but what are the common pitfalls you see early stage innovators who are trying to enter the NHS or the healthcare space fall into?
I think one of the biggest pitfalls is not fully understanding what problem you're trying to address. I think it's great when it's based on your own personal experiences or something, the gap you have seen there, rather than the gap in the commercial market you've seen. But often, if you look at a problem, you're looking at it very much from your own lens. So you are thinking that problem is A, but you're not really working your way back of, is it actually that's the problem? So I think what innovators should be doing is this an actual problem? What is in that space to address anymore, and why is that not working? Speak to users or people who will be affected by it and find out, is this problem only in your mind or somebody else's? Because what we find is we get a lot of innovators going, I've seen this and I've come up with this new innovation and it's really fantastic. And I'm saying to them, do you know there's like 4 other innovations that are already doing that? What does your innovation do that's so much more different? So it's that real, is this needed? Really think, who really needs what I am thinking of doing? Is there somebody, and what by need, I don't mean there's a gap. I mean, there's nothing else filling that space. And if there's something else filling that space, I'm not saying don't do it, because you don't need that healthy competition. But what are you going to do differently that will make yours so much better than the next place, that something else is already doing it? So really think about what you need. And as part of that, you need to be talking to so many other people, not just living in your own headspace and then thinking that your innovation is the next best thing. Some of them are, some of them aren't.
Yes.
But you need to really understand what it is you're trying to do.
Yes. Yeah. I mean, that's fantastic. And, as someone who's tried to do similar things and lived in her head of it, I could not concur more. So important to understand that product market fit as you described. So final question from us then for today, along the same theme. What would be your best advice to someone then who has a brilliant idea, other than obviously doing the things you've just said? So go and talk to the right people, make sure you understand what gap you're filling and how you might be different from your competitors in that space. What other advice would you give to a brand new innovator with a great idea? Where should they go next?
I think your first point of call is a HIN, Health Innovation Network. They have really great expertise, and they've got people who will just talk to you, because I do think talking is really, really important. I think just going to someone and saying, "Oh, message me, I'll happily talk to you anyway." I mean, just find people within the industry who you can have a conversation with.
Oh, brilliant.
We can say brilliant idea or not a brilliant idea, or we don't know. You should speak to this other person. But you need to speak. I mean, it's pretty obvious. You need to speak to people in order to understand whether or not it's a great idea. And I know I'm repeating what I just said earlier, but somewhere like a Health Innovation Network, they have a range of expertise that can help you. So if the person you speak to doesn't have the expertise, they can go to someone else. But there's so much support out there. I think also do a lot of research in that space. See what else is out there. Don't automatically assume there's nothing. And I have had so many innovators come to me and say, and I go, well, who's your competition? And they say, well, we have no competition in this space. And I literally just put into Google what they're doing, and I've come up with like 5 or 6.
Oh, wow.
And I'm thinking to myself, have they not used Google before? Because are they no search engines? But it's that like, you need to do your research and make sure that your great idea is actually a brilliant idea. It's not been done, but speak to the HINs, Health Innovation Networks, amazing group of people who can help you at least understand whether or not what you're doing is novel or different.
Yeah, no, that's really helpful.
Research. That's basically it. I mean, there's no other way to get it off the ground.
No, absolutely. And I couldn't support more about the HIN. So I've done a program with HIN South London, HIN West of England, and then they put me in touch with the Midlands, who I'm talking to. Also, we're hoping to have a meeting with Imperial College Partners. So I mean, they've connected us to these other HINs as well. So just a bit of a shout out from me as well for the lovely folk who work at the various HINs, and especially the ones that I've worked with have been so fantastic, and so on and so forth. And I guess, I mean, any other resources you would recommend? So obviously there's lots of industry events. Yeah, there's people on LinkedIn who are very vocal. Is there any other resource you would recommend to do that research?
There is the MHRA. If you're thinking you're going to create something,
medical device,
call them. They will give you some advice saying, what's your next stop. I would literally reach out to innovators in that space as well. Innovators are always happy, as long as you're not competing against them. They're always happy to give advice, genuinely. So something like Tom from Doctor Doctor, he's always happy to speak to people. I'm sorry. But I mean, like, he's always been willing. And I think most of our innovators are always willing to chat with people. I'm always willing to chat with people. Anybody within any of the innovation programs, I would look to see what's in your area as an innovation program, support program, and they will be willing to speak to you, because this is the space we live in and this is what we care about. So we're the kind of people you should be messaging and saying, okay, just have 5 minutes of your time. And we'll give you 5 minutes. If you see a clinician too, if you can meet a clinician, if you're doing something to do with GPs, go to your GP and just send an email to them and say, I'm interested, anybody willing to speak to me. I think most people in the health system are all trying to find a way to make it better. So tap into us. We're here to help.
Fantastic. Well, on that brilliant note, I hope you don't get flooded by anybody listening. But thank you so much, Mindy. It's been very candid, very straight talking, and some great advice on how to break into the NHS. So thank you so much for your time.
Thank you so much, Karina. Lovely speaking to you.
You too. So that's all for today's episode of Inside Health Innovation. A big thank you to Mindy for her really honest, candid, and practical insights about what is missing from our landscape, as well as how to really get those innovations out there to the people who need them. If you're an innovator hoping to make an impact in healthcare. I hope this episode has given you lots to consider and also some ideas to potentially take forward. To learn more about the NHS Accelerator program, please visit nhsaccelerator.com. And if you enjoyed this episode, please don't forget to like, subscribe, and also rate our show. It really helps us grow. Thanks so much for listening, and until next time, keep innovating.